And how we begin in South Africa, where doctors and healthcare practitioners have successfully petitioned the country's power utility to exempt hospitals from rolling blackouts. South Africa is in its fourth week of daily electricity cuts as a part of its ongoing energy crisis. The cuts mean that some can experience power cuts of up to 4 hours at a time, up to 3 times a day.
But this week, healthcare professionals petitioned the power utility Eskom, asking it to exempt hospitals from rolling blackouts as it could affect services at the facilities. The petition needed 50,000 signatures, and so far, close to 40,000 people have signed. As a result, more than 36 hospitals are already exempt from power cuts. Joining us this morning is Dr. Angelique Kwetsi, a member of the South African Medical Association and the spokesperson for Solidarity Doctors Network Advisory Committee, to tell us more. Good morning, Dr. Angelique. Thank you for joining us on the show this morning. 36 hospitals already exempt from load shedding. Now, what does this mean? That your petition was successful, or are there still many hospitals that still need to be exempted? Give us an overview about this.
Good morning. It's a very important question that you have asked, and the situation are quite dire in South Africa at this stage. So the hospitals that is predominantly at this stage excluded or from power cuts is the public sector hospitals. So in the private sector, these hospitals are all having their own generators, trying to mitigate the problems arising from power cuts. However, doctors working in solo practices, specialists doing procedures at their surgeries, they have a problem as the generators cannot always fulfill all the necessary electricity that is needed in those surgeries. So just to come back to these hospitals that's now been exempted, it is true, it is after we have started to do a petition. However, what we cannot understand is this problem is a problem that's been there for quite some time, and why have the authorities not decided before this to come up with this plan? Why did we as health practitioners needed to do a petition on this? The problem with these power cuts and these hospitals not having enough electricity is that the public sector hospitals' budget are running out of diesel or petrol, and not all public sector hospitals or clinics even have generators. So it's a huge problem just on the electricity problem that we are facing.
Well, but give us a clear understanding, because for those who may not be affected or in other parts of the continent, they may not understand how this really affects the healthcare industry. So can you give us a picture of, about the need for this petition, and when healthcare professionals say the blackouts are affecting vulnerable people in hospitals, what do they mean, and how bad really is it?
Yeah, it is, as I've said, it's a dire situation that we are in. So what happens is, if there's not electricity in the hospital, let's say there's four times a day power cuts of about 4 hours, even if it's 3 times a day of power cuts of 4 hours, your electricity are needed to do electronic health records. So your electronic health record system with the patient's information are not online. Your fridges that are supposed to have a certain temperature for your vaccines and other medication, that become compromised. If you are busy in a operation and it's a very, let's say it's a delicate type of operation, and the power just go off, the generator is not kicking in immediately, that is a problem for the surgeon or whoever is busy with that patient. Your children or babies that are in incubators, they are compromised. Your ICU patients who needs to be on ventilators, they are compromised. Then electricity itself is not there, is not enough light. There's no ventilation going on, because a lot of the hospitals doesn't always have windows that can open. So that is a problem. And on top of it all, what we are now seeing is, because of these power cuts, the water tanks, the reservoirs, cannot stay ahead with pumping water into the reservoirs, then we have now this problem in 2 hospitals in Gauteng, where there's not enough water now as a result of this. Now, the problem with the water, if you don't have enough water in your wards or in your hospital, that leads to non-hand washing, that leads to toilets that can't be used, that leads to cleaning. So with the results that your infection rate is going to escalate, with patients coming in for, let's say, a cold and flu. The nurse is not able to wash hands. No one can wash hands. There's nothing to do. And so you will then contaminate and spread diseases going forward. So it is a problem that we are seeing. It's an unacceptable problem. And we think that the government should have been proactive on this and shouldn't have waited for us after a year where doctors and hospitals now had enough of this, that we needed to start with a petition. It should have come from a national department and provincial department.
Let's talk about the next steps of this process. What will the South Africa Medical Authority be doing to ensure that all health facilities are covered?
There's not a lot that we specifically can do. What we can do is we can ask the members, please alert us, and then again, try to put pressure on these different provinces and on the different ministries that are involved with this, and try to get them to change the system and to get these hospitals and clinics, as well as where the private sector doctors are working, to get them on the grid, so that what happens if there's a power cut, that at least there's uninterrupted electricity in those places. That's the best that we can do. And then the media plays an extremely important role, because the media helps us to put the pressure onto the various governments and provincial departments to see how we can rectify this. But this is most of the times poor management as well. And as I've said, public sector hospitals most of them are running out of funds to buy diesel and petrol. So that's another problem.
All right. If you can, in maybe 10, 20 seconds, just clarify for us if there's been any patient or any crisis that has resulted from these power cuts in hospitals. Has there been any patients that has complications or maybe even more due to power cuts?
Anecdotally, we know that there is problems. Unfortunately, there's nothing put in place from the provincial or national Department of Health so where we can alert them of the problems that we are experiencing if a patient is being compromised. There's no channels open on that. So government might easily say they are not aware of this, of anyone compromised, but they forget to say there's nothing put in place, so that we can communicate directly. Because to whom do we communicate at this stage if there's a problem? We communicate between ourselves. That's why I'm saying it's anecdotal. We know there's problems. We know patients are compromised.
All right, Dr. Angelique, thank you so much for your time this morning. We do hope to have you again with some good news when you join us back on the show again.